It is a difficult decision facing families who cannot afford health care, specifically how to pay for dental care. Just keeping the annual checkup proves to be too expensive for some, and the quick decisions they make could result in higher costs down the road. Joining me today to discuss the choices in dental care is Dr. Richard Manski from the Office of the Institutional Advancement of University of Maryland School of Dentistry. So good morning, Doctor.
Thank you very much. It's an honor and pleasure to be here.
Yeah, well, thank you very much for joining us. Now, I mean, we have families that are stuck. They're in this position. They really don't have health care. I mean, it's too expensive for a lot of families now. And so then when all of a sudden, you know, a daughter or son or themselves gets a toothache, they start making some decisions that are just poor decisions and actually costly later on. What's the best way or best plan for them?
Sure. Well, the first thing to consider is the time to look for a dentist is not when you need a dentist. Time to look for a dentist is much, much earlier. Okay. It's very important to develop a relationship with a dental provider as early as you can. And the truth is, you know, everybody needs dental care. And as far as the most people, you know, in this country and in this state, most care is provided by dentists in private practice. So the first step would be to call the Maryland State Dental Association. They have a very nice tool. Okay. And if you want, you can go to their website, msda.com. They have a nice referral tool. Okay. Now, if it turns out that we know that dentistry can be expensive, and if that doesn't meet all your needs, you could think about coming to the dental school. The dental school also offers dental care at reduced fees, fees that are somewhat lower than they might be in private practice. Okay. But it's a nice option. The trade-off, of course, is that the treatment might take a little bit longer.
And how so is that?
Well, because students are providing care under the supervision of faculty, and it's a learning experience. So there may be interruptions in the treatment as faculty want to provide instruction to the students and they dialogue during the treatment. So the procedures may actually take longer, but the fees can be reduced, and it's a nice option.
And is that an option that you can use to establish with a dentist, or is this one of those things where it's a one-time kind of go to the University?
No, in fact, we prefer that we provide comprehensive treatment at the dental school. So you would come in for a screening process, and then you'd be assigned to a third or fourth year student, and you would develop a relationship with that student. Of course, students graduate, and then you'd be reassigned to another student and develop a new relationship.
And what kind of cost, though, are we talking about here?
It's less. And the dental school actually has multiple programs. We have an undergraduate dental program where we might have our lower fees, but then we have graduate dental students, people who are actually dentists going for additional training to become a specialist. Those fees are a little bit higher, and we have faculty who practice there as well.
And so are we talking about like a family that has some infants and then they're becoming toddlers, start coming in, just kind of get checks, routine checks, or should they wait?
No, the American Academy of Pediatric Dentistry recommends that upon the first sight of a tooth, usually within 12 months, by 12 months, that an infant should have their first visit with a dentist.
Okay, so establish it within the first year of life then. I mean,
yeah, and truth is, you shouldn't wait to that point either. If you're looking for a dentist, it's important that you develop that relationship again earlier. Interview dentists, find out the person that you want to talk to. And for people who those choices don't work out, the Department of Health and Mental Hygiene Office of Oral Health has put together a wonderful, wonderful resource guide that provides information across the state about other alternative programs.
And we're going to talk about those programs in just a little bit. I want to go to break and make sure that we get some calls in and some Facebook and Twitters as well for you. Okay, well now after the break, the best affordable dental choices with Dr. Richard Manski. We'll be back to take your calls. If you have any questions, our phone lines are open now at 410-481-4545. You can send us a tweet at Fox Baltimore or go through our Facebook page. 7:53 is the time. You're watching Fox 45 Morning News, all local, all morning.